Hi everyone, and welcome back to our Bupa Dental Bitesize On Demand session. This series is all about filling in the gaps to your all-important dental queries, providing you with the wisdom to help keep your dental care on track. So today I'm joined by Susie Lloyd, who is a practicing dentist at Bupa Dental Care, and today we're going to be having a conversation around all things dental anxiety. Thanks for joining us, Susie. So what is dental anxiety and how does it manifest itself?
So dental anxiety, can take many forms. Like anything, it's on a spectrum. So on the left, you might just feel mildly anxious about going to the dentist, but still feeling as though you could cope. But then on the right of arc, you may feel as though you have very extreme levels of anxiety. And that anxiety may be so bad that you feel you can't attend the dentist. And when you do, that you suffer from basically a phobia and panic attacks. And some people do have that level of a phobia about going to the dentist. Things that they experience are sweating, fast or pounding heartbeat, and a feeling that they might feel quite faint, crying, and feelings of panic.
How many people in the UK are affected by dental anxiety?
So research shows that around 4 in every 10 adults would say that they had a fear of the dentist. We know that as a profession we're not greatly loved, unfortunately, but we are trying to change that one dentist at a time. And around 1 in every 10 adults would say that they had some form of extreme dental anxiety. So if you're out there and that's you, you're not alone, but it is really important to still come and see us and get the help you need. Yeah,
it sounds really important. And what causes dental anxiety? Could it be that they've had a bad experience, for example?
Yeah, but that's exactly right. So it can happen for lots of different reasons, but it's generally related to maybe a bad experience as a child or even as an adult. I think it's fair to say that there's some maybe poorer connotations in the last 20 or 30 years about what dental treatment used to be like. So some of my adult patients, when they recall the dental treatment they had as a child, and sometimes they don't have great memories about that, but I'd like to reassure everybody that things really have moved on. All of our dentists are really trained to recognise dental anxiety and to really put patients at ease and make sure that the treatment is going to be as pain-free and discomfort-free as possible. But it's fair to say that a lot of people are probably fearful because there's a bit of a kind of unknown about what's going to happen when they go to the dentist. They may have a fear of not being in control. And as a clinician, I do really try and remember what it feels like to have treatment myself. It's fair to say that you are doing treatment that's in a very invasive place within the body. Things like noise of some of our instruments do feel quite loud to the patient, and injections generally aren't loved, let alone in the mouth. So there's also, a few fears about things like choking or gagging or that kind of stuff, or I would say that's generally quite unusual. Other things that you can feel anxious about when you go to the dentist might be that, it's been a while, and so you feel a little bit self-conscious or embarrassed about your smile. Please don't be. There's nothing that we haven't seen. And also probably added in there is these days the cost of treatment. So, money worries adding to all those potential anxieties can result in people ignoring any pain or treatment that they're aware of needing. I would say on that score, please do speak to your dental practice about that. Every practice will offer finance or payment options, so please don't let that be the reason that you don't seek the treatment that you need.
And is there anything dentists can do to help ease these feelings for the patients, for example?
Absolutely, there's lots we can do. So first of all, the main thing we can do is understand, and you as a patient can make us aware of your feelings. So obviously we can really work hard to make sure that you're put at ease. Things like developing that feeling of trust between the dentist and the patient is really important. Building a rapport. Having a relationship where the dentist is always going to stop as soon as you ask them to stop, and please be reassured no one is ever going to do anything to you that you don't want them to do. So the other things that we can do are really making sure that we acclimatise you to treatment. So that's why it's best to come and visit the dentist more regularly. We don't really want to leave it until you're in abject pain before you come to see us. So if you come firstly for a checkup, then things like x-rays, then things like a nice relaxed clean before you might need any, say, minor fillings or anything like that, that gives you the time to start acclimatising to that treatment. Also making sure that the local anaesthetic that's given is extremely effective is really useful. Most patients that I have that say they're slightly anxious are really reassured when they realise that they can't feel any of the treatment whatsoever. Most of the time it's the anticipation of the event is more of an issue rather than the actual event. So as soon as you know that you're not going to feel any pain or discomfort, then that's really useful. After that, if you're still feeling as though dentistry really isn't for you, then there are things that we can do, for example, dental sedation. And there are very, very few people out there that even that might not be the best thing for them, and they might require a general anaesthetic to get treatment done.
And you mentioned sedation. What is sedation? Can you tell me a bit more about it?
Sure. So dental sedation is basically a way of making you feel more at ease during dental treatment. It doesn't put you to sleep like general anaesthetic. You will be conscious and able to talk with the dentist. But it puts you into a very deep and relaxed state where you won't feel any discomfort or pain, and also you won't remember what has happened during the procedure. There are three main ways that you can be sedated. The first one is oral sedation, which is when you take a tablet to relax you. Generally that's from the Valium family of medicines, and dentists in the UK would usually liaise with your general medical practitioner, your doctor, to prescribe that and then ensure you take the medication on the morning of your appointment. Secondly, we might prescribe conscious sedation, and that's where you inhale a sedative gas through a mask that your dentist places over your mouth and nose. And then thirdly, we have intravenous sedation or IV sedation, and that's when you have a little cannula placed in the back of your hand, and then we inject a sedative drug through your vein. And sedation isn't just for invasive procedures. You can have it if you absolutely need to for more routine procedures like hygienist appointments, where your clinician makes sure that you've had a really thorough clean.
Thank you. And the word sedation, it makes you think that you'll be in a hospital bed overnight. So what does actually happen afterwards?
So it's essentially just a little bit like just going to an extended dental appointment. So you're not in hospital, you're not an inpatient or anything like that. After you've finished your treatment, you are required to stay in the practice for a short period, and that's just to make sure that the effects of the sedation you've had have worn off. Your clinician will make sure you're fully recovered before you're discharged. We would recommend obviously not driving for 24 hours, so you will require an escort to pick you up and take you home, that you don't operate machinery, you're not alone, depending on the type of sedation that you've had, and that you don't do any exercise for 24 hours. But no, it's not like having an operation.
No problem. And lastly, Susie, what would you say to someone who hasn't been to a dentist because of their anxiety and now they're too embarrassed to go?
We see teeth day in, day out. There's probably nothing that, especially the more experienced dentists, haven't seen. We're not here in judgment, we're here to help. So please be rest assured, it's never too late to improve your oral health, even if you've avoided it for years. Thanks so much, Susie, for being here today. It was really interesting. And thanks everyone for joining us today, and we hope you enjoyed the session.